So what is advanced clinical practice? I'm not a big one for putting a lot on my slides. I prefer just to put little bits and talk about them. But this part I'm going to read out. Advanced clinical practice, ACP for short, is a defined level of practice within clinical professions such as nursing, pharmacy, paramedics, and occupational therapy. This level of practice is designed to transform and modernise pathways of care, enabling the safe and effective sharing of skills across traditional professional boundaries. And that's a recent quip from Health Education England in 2021. Well, advanced clinical practice is, the first thing to understand is that it's governed by a multi-professional framework, and also one of the things that the multi-professional framework for advanced practice did was it came up with a clinical definition or a definition for an advanced clinical practitioner, because at one point there were so many local and regional definitions of advanced clinical practice that really it was ambiguous as to what actually constituted someone working at an advanced clinical level. So now, to be an advanced clinical practitioner, you have to have this master's. You have to have been through and done the training, and you'll have the same governing body, the same way that HCPC Protect does. Eventually, that's not up and running yet, but eventually that will be the case. So what makes an advanced clinical practitioner? So you have to be part of the NMC, which is the Nurse and Midwifery Council, or you have to be part of the HCPC or a pharmacist registered. You have to be a healthcare professional before you registered with one of them bodies before you can apply to be an advanced clinical practitioner. You have to be educated to a level 7, which is a master's level. So you have to go and do a master's degree. And you have to work to a level that pulls together the 4 pillars of advanced clinical practice. Degree itself is a 3-year master's, which is done part-time. You can do it full-time in a year. There are a number of universities offering the course now. I did mine at Liverpool University, and we were the first cohort to go through. I did mine as a part of the apprenticeship route, so I was working whilst learning, which I'll talk more about shortly. And the last part of this is the 4 pillars of ACP. So these are things that I don't think people, or I didn't understand fully before I started the course. I think when people think of extended scope or advanced clinical practice, they potentially maybe more think of the ANPs, advanced nurse practitioners, which are now advanced clinical practitioners, maybe running their own clinics, sending people off for investigations, things like that, or maybe those physios that do some Botox injections. That's what people think constitutes an advanced practitioner, but actually that's not necessarily what an advanced practitioner are. There are 4 pillars that you have to work to, and these are the 4 pillars that it centres around. So there's the obvious one, which is clinical practice. So that's extending your scope within a clinical setting, which we'll touch on. Leadership and management, which is phenomenally complex and important within healthcare. Its importance against clinical practice is a debate, I think, within itself. It seems to be more emphasis on leadership and management, in my point of view, than clinical practice, but that's not necessarily for today. Third being education, so getting yourself up to the level where you are a level 7, which is a master's level, and then the 4th, which I think is the most important, particularly when we're talking in prosthetics and orthotics, which is research. Because what I found doing the masters was when it came to me doing my assignments and essays and dissertation, it was hard for me to pick any topics to talk about. Writing at level 7 is completely different to a level 6 at a degree level. It's much more in depth. You can't really have any opinions. Everything has to be written before you, and then there's an element of debate within your writing. So the research part of it is really, I think, and always have done, and I'm sure a lot of people share this view, is something that we, not just research, I'm talking about quality research, not just research in general, but quality research is something that this profession needs to really focus on. They're the 4 pillars of advanced clinical practice in a nutshell, and they are ones that the course focuses around. It's not all about just learning how to interpret an X-ray, or how to order investigations or what investigations to order. A lot of it focuses actually around the administrative side of your job rather than just the clinical side.